since '85 I've worked in music therapy, initially in this Calvary Healthcare Bethlehem. I also worked for about 10 years with the veterans in a Department of Veteran Affairs hospital, which in Melbourne, which eventually amalgamated with the Austin. And then I started working at Peter MacCallum Cancer Centre, worked there for 15 years and with the cancer patients there, and have worked substantially also at Caritas Christi Hospice, where I still do music therapy. Been there for about 8 years. What my work as a music therapist involves is offering music to patients with advanced life-threatening illnesses, and it's up to them to decide whether or not they want to be involved or use it. When I meet a patient, I say, my name is Claire, my job here is about just offering only for those interested music. And depending on how the person responds to me then will determine how I then continue and describe what it does. But I might offer a range of methods, and I tend to say sometimes people find that music can just be relaxing or enjoyable. The idea is we explore ways that music might help them get through this time. Music therapy is the creative use of music in a professional relationship with patients to address physical, psychosocial, emotional or spiritual needs. And the idea in palliative care is to help people have the best quality of life possible and to increase life satisfaction. And we don't prescribe music, and that distinguishes us from something like music thanatology. We try and understand how the person wants to use music at this time, and we offer a range of methods to enable that. And anyone can be involved. You don't have to be a musician to be involved. The kinds of methods we use include live music. And so when I offer music in the palliative care unit, I wheel an electric piano around, and I have about 6,000 songs and classical music from all around the world, a variety of genres, so that I can try and offer to play something that the patients and maybe their families, their visitors, if they're there, want at that time. And I find that people tend to choose music that reflects the feelings, the memories, the people in their lives that they want to connect with and gain support with, or have some kind of enjoyment or pleasure related to that connection. Or a contemplative space, a time to be, And so after I play, I wait, and sometimes people want to reflect on what is elicited for them through that music. Sometimes people will ask me to play the song again. They might ask me to play something completely different. And so I give people opportunity to just reflect on what the song means. And I find that sometimes people gain tremendous support from the identifications with the memories it elicits or the people, but sometimes the lyrics of songs can sometimes enable people to feel less alone. That if someone has written this song like yesterday, you know, all my troubles were so far away yesterday, someone understands. You know, one person told me about the song Who's Gonna Make the Gravy by Paul Kelly, and how when she came to a cancer hospital to have treatment, that song was for her what helped really support her, enabled her to feel less alone. This was a young woman who had to leave her 3-month-old baby in the country while she was having cancer treatment in the hospital for head and neck cancer. And that song it just really encapsulated how she felt, you know, who's going to look after my family? But when I saw her as a music therapist in the hospital, she was totally resonating with Claire de Lune, that music helped to relax her. It helped to also distract from the noises in the next room, which she thought was a dying patient, and she just needed to be disconnected from. Music therapy can also be helpful for pain control, and the research shows that it's music preferences that can help sometimes. Not always, but sometimes people tell me that music can distract from pain, distract from nausea, help relaxation. So not only in my own work, but I encourage all people to think about offering people their favourite music or their preferred music to deal with some of the symptoms that can arise in palliative care patients. I have looked at CareSearch intermittently over many years, and I find it a wonderful service because it's a repository, it's a little goldmine really, with just so much knowledge that has helped me, and I certainly refer music therapy students that I come across to go and explore it, because there's so much to explore really, and it includes a number of the meta-analyses that relate to cancer and palliative care. You can go there and at your fingertips get a whole lot of knowledge related to music therapy, and also I was noticing recently there's some online components. For example, I was looking at the motor neurone disease. What is motor neurone disease? I was thinking, gee, that's really helpful. That's certainly something I'll be referring students to who need further knowledge in that. And as I'm looking through, there's just lots of related information that you can access. And I do some teaching. I've done some teaching in complementary therapies, and there's a whole broad knowledge of all the different complementary therapies there. So, I applaud the work that CareSearch is doing, and may it continue to just be expanded.